I recently had a friend who had a clot in his legs when he was traveling for a period of 4 to 5 hours in a car. Now, if you develop a clot because you're immobilized in such a way, whether you're traveling in a car or flying on a plane, these are often known as risk factors. So today I sort of broke down some of the commonest risk factors, whether you get a clot in your superficial system or your deep system, known as a DVT or deep vein thrombosis. Here are some of the risk factors or causes. So one that I've already mentioned is prolonged immobilization, where you're sitting for a long period of time or even lying down for a long period of time. If you've had a big marathon and you're resting, or you're having recovery for whatever reason, you're lying down for a long period of time. Another cause would be surgery. So if you recently had surgery on your bones, your legs, even your abdomen, this increases your risk of getting a DVT. Pregnancy, again, is another factor that causes DVTs. Age over 60, smoking, if you're overweight, even if you have varicose veins, and commonly patients with varicose veins can get clots in their veins itself or their big bulgy veins, but this can sometimes extend into your deep system. Now, if you have cancer or have had cancer, this again would be a risk of developing a DVT. The next bit which I would mention, which is a risk that often gets missed, is if you have a thrombophilia or blood condition that increases your risk of DVTs. Now, the reason I mention this is it often gets forgotten because it can occur for very trivial injuries, whether you are driving in a car for 2 hours, which is actually very low risk, or even having a small medical procedure and developing a clot. Again, when you have trivial risks or injuries and you develop a DVT, these are cases which I often will say you need to get that investigated. Now, if you've obviously had major surgery and developed a DVT, oftentimes doctors won't investigate this, but if you've had something trivial, this is the time where you would want to get it investigated. Now, when it comes to provoked and unprovoked, every risk factor that I've mentioned, including injury, immobilization, or even surgery, these are provoked cases. An unprovoked case would be that you were walking, going by your day, and all of a sudden your leg blows up and you go and get it tested and you actually have a DVT. Now, this had no injury to cause the clot, and these are the cases you should definitely get that investigated to find out exactly why you developed that clot.